Hi, I'm Dr. David Rowe from Rowe Chiropractic Offices. Today's topic is about mid-back pain. Now, in terms of occurrence of pain, it's much more common first that people have low back pain. That is the most common pain in the spine. Second, neck pain. But mid-back pain can be absolutely just as debilitating, and it can be a chronic situation that goes on for long periods of time. Now, in terms of research, generally the neck and the low back have been researched in spinal mechanics much more than the mid-back. But it's interesting, the mid-back could be viewed almost as the anchor or the stabilizing structure of our spine. Let's look at the way that the spine is built. We've got a foundational pelvis that attaches to the legs. The pelvis is what the spine is going to sit on, and specifically the sacrum. We've got this lumbar spine, the low back, and then here we have these 12 vertebrae that make up the mid-back, and then we have our neck. The mid-back is unique is that it also has the rib cage associated. So the mid-back is a very, very stable structure. It has less motion. Most of our mid-back motion is in rotation. We do have some flexion, we do have some extension, but most of it is the primary motion of the mid-back is rotation. And let's talk about what normal posture is in the spine. Now, if we're just looking at a person, we should be straight this way. When we're looking at this dry spine, it should be straight in this position. But from the side views very differently. So we'll go this way. If you look at the spine from the side view, we're supposed to have these three slow sweeping curves. And in terms of the mid-back, this is super important. We'll get this guy aligned here. The mid-back is supposed to have a nice arch like this way in my mid-back, and that's the anchor of the spine. Now, in that normal position, and by the way, these are the discs in between the vertebrae. They're spacers or gappers that keep the vertebrae separated and allow space for this very important nerve to exit, because it's going to go to all these vital organs in the chest and in the abdomen. So the normal spine is straight from the front, curved from the side. It should be an arch like that, and that arch builds this beautiful shock absorber for us. It's also the anchor because of the rib cage. It not only protects the organs, but it's an anchor for our whole spine. So it's straight from the front view and curved from the side view. One of the cool things about the curve is that research has told us exactly the shape of that curve. To get a little bit geeky here, for most people, that's supposed to be a 44-degree curve. Well, because we know what it's supposed to be, on an X-ray, we can measure any individual person's curve on a discovery exam and see if their curve is normal, and if it's not, how is it not normal? How has it deviated, so that we can come up with specific strategies to get it back into correction. Curve this way, and front straight from the front. But what if we have traumas or injuries to our spine that cause the mid-back to misalign out of its normal position, changing the normal structure, posture, and mechanics? When the vertebrae misalign out of their normal position, they put mechanical stress on the individual nerves, but also on the spinal cord itself. When it puts stress on the nerves can't send a normal signal, and the body weakens in its ability to function normally. Now, if the mid-back say, oh, is Dr. Rowe talking about scoliosis? Yeah, if it's over 10 degrees and there's rotation, it is a scoliosis. But even under 10 degrees, these individual misalignments, these subluxations, will put damaging stress on the delicate nerves, interfering with the brain's ability to send a normal signal to the body. Now, about 7% of our nerves are pain sensitive. What? Yeah, only 7% of our nerves are pain sensitive. 93% of our nerves have nothing to do with pain. But if we have these spinal subluxations, these postural misalignments, and if they affect the spinal nerves that are pain sensitive, to be a little geeky, they're called nociceptors. If our misalignment affects these pain-sensitive fibers and enough of them get irritated, then they signal into our brain a red alert signal that we interpret as pain. The pain comes because of the mechanical irritation on the nerves. Why mechanical irritation? Changes in the posture. So it always goes back to our normal alignment protects our nerves, but subluxated postural deviations, misalignments, puts stress on our nerves. And if we get enough stress on our nerves from these misalignments, these subluxations, it'll cause mid-back pain. But there's hope. And the hope is that if we can find out exactly where in the spine it's misaligned and in what direction, we can come up with these very specific techniques through adjustments and postural correction. And we use, in our office, we use two main techniques. Our adjusting technique is called Gonstead, and that's how we adjust the individual vertebra. And our global postural technique is called chiropractic biophysics, or CBP. And we use these two techniques to give our patients the best chance to correct their posture, take the stress off the individual nerves, and allow the body, which is self-healing, to go ahead and begin its healing process. Now, how do we actually do this? Well, the Gonstead is an adjusting technique. We're actually putting the vertebra into place, and we'll show some of that later in the video. And the chiropractic biophysics is a postural corrective technique, where we use both mirror image exercises. So to imagine that somebody's mid-back is misaligned like this. That's their subluxation. So we'll do a therapeutic exercise to push them opposite, and we do that exercise over time so they'll be realigned in the middle. We'll also create postural, what we call mirror image adjusting. So once again, if the person's misalignment like this, we can adjust them in that direction to help correct it. We also can do both in-office and home traction, where the patient is working on the traction units to help correct the posture. Well, why the traction? The research tells us that unless you can hold the spine in a corrected position for a minimum of 10 minutes, you won't get the discs and the ligaments to re-educate, or what we call remodel, back towards normal. So if you could create some type of a traction device where we push the spine towards correction and we hold it there for over 10 minutes in either a traction device or a home traction unit, then we can go ahead and begin to remodel the spine to correct the posture, to take the stress off the nerves, to allow the body to heal, and then that's how we get rid of the pain.